So I'm Dr. Mok with Allure Medical, and I want to answer a question I commonly see, particularly I see a lot of these questions on Facebook. You know, do you dilute the Botox, or is the Botox diluted? So I want to explain what that means. So a lot of times people are wondering, are you ripping us off, right? So if you said, are your gas station pumps rigged? Or did you write the wrong price on the thing? So that's one thing, is that when you say that, kind of you're asking, are you stealing from us? So I'm going to show you what really means to dilute Botox. So I think because we know we dilute Botox, and people think they must be getting ripped off, I'm going to show you what it means to dilute Botox. So Botox comes in a dry powder. This is an unopened bottle of Botox cosmetic. It's got a little cap on it. This is from the United States. There are some Botox that come from other countries. You can look for it and make sure it's Botox cosmetic, which is only available in the United States. And right in the bottom, I'm sure you can get this little white powder here. That is not the Botox. That's actually the carrier of the Botox. This is albumin that carries the Botox. The Botox is so tiny that all the Botox in this bottle, you can never see it with the naked eye. Okay, you couldn't even see it really with a microscope. It's so tiny. So they put it in this albumin and it gets stuck to the bottle. So when they make the Botox, they got a big tub that they mix it up in, and they put one little micro drop in a bottle, they seal it, and as it dries out, it has this little residue, and there's a little bit of salt and albumin in the bottom. Now, Xeomin has a little cake in here, and they ship them over from Germany, and there's a little cake. So we cannot inject, can you see the little cake there?
Yeah.
You can't inject the cake or the residue into somebody's face. It would be impossible. Okay, we couldn't scratch the bottom and get it because it wouldn't really work. So we have to dilute it. Now there's 3 dilutions that are commonly used in the world. And there's actually a 4th one I'm not gonna talk about because it's not for cosmetic purposes. So the most common dilution is 2.5 cc's of what we call normal saline. So 2.5 cc's of normal saline. So we take the Botox bottle, uncap it, and go right through the center, and drop and it sucks it right in. There's a little vacuum in there. Drop the 2.5 cc's into here, mix it up. And when I do the 2.5 cc's, that means when I draw it up with this syringe, which is a 1 cc syringe, each 0.1 cc's contains 4 units of Botox. Okay, so if I take 2.5 cc's with 100 units of Botox, mathematically that works out that each 0.1 cc's equals 4 units. And then I draw it up, I attach a little needle to it, and I inject the Botox. Okay, so that's the most common dilution, is 2.5. That's actually the least common one I use. So I use most commonly a 1 cc dilution. So again, I take another dry Botox, this little powder here. Again, there's no way for me to inject that without diluting it. And I take the saline and I inject 1 cc. Again, it vacuums it right in. And I just give it a little swirl. And now we have one bottle has 100 units, and now there's 100 units per 1 cc. So then I take what's called a tuberculin syringe, and this is 0.3 cc's total. Okay, with this dilution, this would only have 12 units, but because I used 1 cc, these are exactly as it's written here: 5 units, 10 units, 15 units, 20, 25, and 30. So 0.3 cc's has 30 units. Again, we have 100 units in 1 cc, so 1 cc would be 100 units, and 0.3 of a cc would be 30 units. And we really like these because we can pre-draw them up. The needle is very tiny. I can barely even feel when I stick it in my arm. Okay, it's very tiny. And I decap it and I suck the Botox. I'm not gonna use this one, of course, because I stuck my arm with it, bleeding a little bit there. But these ones here, we actually kind of pre-make them because we don't want to stick the needle through the rubber stopper because it kind of dulls out. So we draw these out very gently and then we label them. So this is the most common one we use at Allure, but it's most common probably worldwide. In the US, it's actually more common to use 2.5. So that's the most common one we use. We use less dilution that gives me a little bit more precision. It doesn't spread quite as far. And it lets me use a syringe that gives me the exact number. So it's really kind of simple. Then the other common dilution we use, again, I have the Botox here with the dry powder in it, okay, is 5 cc's of normal saline. So I take 5 cc's of normal saline and I let it, again, sucks right in. I swirl around a little bit. Now I take since I have 100 units in 5 cc's, then each 0.5 cc syringe, again, a different syringe, it's bigger and smaller than this one. So 0.5 cc's has got 10 units in it. Okay, so now I've taken 100 units in 5 cc's, so it means 1 cc has 20 units in it, and a half cc has 10 units. So then I draw these up, and I know that each notch on here is a unit of Botox. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So when do I use 5 cc's? Well, quite commonly, when we're treating areas that we need a lot of very significant spread of the Botox. I want it to spread a little bit, but I'm using a tiny dose of Botox. These are much more controllable because there's more liquid, it's more diluted. Okay, so more dilution lets me give less units in a given area. That's where we treat with the forehead. Okay, if I'm treating the neck, I want it to spread further, so I want it more diluted. So dilution allows me to get it to spread further. It doesn't change the number of units that you're buying. Okay, the dilution is not relevant. Some people even dilute with 10 cc's, they want it to really spread, but it doesn't change the number of units you're buying. When you're buying a unit of Botox, doesn't matter how much saline's in with it, there's only 1 unit. But we use a system to know how many units we're using based on the syringes. So at Allure Medical, we have 3 different types. We pre-make these, our 3/10 of a cc, which is 1 unit per 1/100th of ml. We use our 5 cc's, which is 1 unit per each 0.1 ml. I'm sorry, 2 units per each 0.1 ml. And then our 2.5 cc's, which is 4 units for each 0.1 ml. So that's how we dilute the Botox, and we do the same thing with the Xeomin. Dysport is a different story, it has a different types of units. So the Botox is always diluted. Okay, it's always diluted. So when you're hearing people say, I think they're Botox diluted, what they're saying is, I think they're cheating. I think they're lying and being dishonest and giving you less units you paid for. But the dilution word is the wrong word because you have to dilute it. So we have a standard way we dilute our Botox. We pretty much use the 1 cc for most. We use a 2.5 when we're doing some kind of like when we're trying to treat something that's sort of unique because it's in between the 2 spreads of Botox. So that's the least common one we use. One of our providers likes it more than the others, so we keep it on hand. And then the 5 we use for forehead or neck or areas where I want to use less units and have it spread further. So I hope that explains what it means when people say that Botox is diluted. It has to be diluted. It comes as a dry powder. There's no way to get it out of the bottle without diluting it. And if you're thinking, are you cheating? Well, that's a decision you have to make. If you don't trust the provider, you really shouldn't go there if you think they're going to steal from you. So when you're going to your practice, if you think they're diluting the Botox, it means you think they're not being honest with you. You really shouldn't go there. You shouldn't go someplace you don't trust. So you have to have faith in the fact that they're giving you what they're telling you. There's also like counterfeit Botoxes that are potentially dangerous. And also a lot of people buy Botox on the internet from other countries. You can go online and type in Botox or Dysport and Xeomin. You can buy it, and a lot of times the customs will grab it from them. Most reputable, I would think all reputable physicians are not doing that. We certainly have never bought it, used it. It's not legal for somebody to go to, say, buy Botox in Greece and inject it in the United States. That would be a crime. So I guess beware of that. It certainly would be safe. I would think getting Greece Botox is exactly like we have here, but it is illegal, so we don't allow it at all. And that's the answer on diluting Botox. It has to be diluted. If you're thinking somebody's diluting their Botox means you think they're cheating you probably should go somewhere else. And they are diluted at different strengths. So thank you very much.